public transit network optimization model for equitable access to social services. Over to you.
Thank you all for being here. I'm here to talk about a piece of research that was part of my doctoral thesis, which I completed with my advisor, Himanshu Kaul, who's also in the audience today. So basically what we were looking at was attempting to fill some gaps and to explore some traditionally ignored objectives in public transit network optimization. Public transit network optimization is a large and important area of problems. It's a big part of operations research and transportation engineering, but traditionally it tends to focus on a fairly narrow set of design objectives, and that includes things like trying to minimize monetary costs, trying to maximize fare revenue, trying to minimize people's travel time and vehicle crowding. And those are all perfectly reasonable goals. They're the things that public transit planners are directly charged with, and it makes perfect sense that they're the primary things that have been focused on. But focusing on such a narrow range of goals also leaves out a lot of social good that we might be able to accomplish through public transit engineering. In particular, there have been a few recent literature reviews that have taken note of this fact, and they've specifically pointed out that things like environmental objectives and social objectives, which are things that public transit has a major impact on, have been largely ignored in literature so far. So specifically, I'll be talking mostly about the issue of social access, of being able to give as many people in a city as equitable a level of access as we can to the services that they need. One of the big types of problems that's studied in this area is something called food deserts. That is areas of a city which lack access to healthy food options. And it's been noted in quite a few studies at this point that food deserts are in some cities largely attributable to a lack of public transit access in certain areas. And there's also the issue of access to primary healthcare facilities, which a lot of areas of cities and a lot of rural areas tend to lack. Previous studies that attempt to alleviate these problems have mostly focused on the facility location problem. And that would be asking, if you could install some new facilities for people to go to, where would you locate them in a way that would do the most good and that would give people the most access? And that's certainly an important problem, but it's not always an option to install new facilities, especially if it's something that would require a lot of infrastructure to put into place, like a new hospital. That would be very costly and time consuming. So we wouldn't usually expect that that's an option. So sort of as an alternative to that, what we were looking at in our study was something that's in some way the inverse of that problem. Instead of assuming that we have a fixed transit network and then asking where we could locate new facilities, we're going to assume that the facilities are fixed and then ask ourselves how we could alter the transit network to improve people's levels of access. By changing the transit network, you can reduce the travel time that it takes to get to places, which effectively brings people closer to the sorts of services that they need. But the attractive feature of looking at public transit instead of facility location is that it's something that you could potentially put into place much more quickly and much more cheaply. If we're just talking about things like tactical decisions like bus scheduling, then that's something that we could put into place potentially immediately and for a low enough cost for people to actually consider. In particular, the main contribution of our paper is sort of a general modeling paradigm that can be used to try to adjust problems like this. It's meant to be very general. So I'm going to be talking specifically about primary care access, but that's really just one example. We could be using this to talk about access to groceries or public spaces or really anything else that you want. Specifically, as a case study and as a proof of concept for our model, we're going to be looking at the issue of primary healthcare access in Chicago, which is something that has been noted as a major problem by the city of Chicago for years. In particular, what a lot of these past studies have been focusing on is something, 5 minutes, really? Oh, okay. So specifically what we're trying to focus on is making improvements to the transit network to try to make it easier for people to access these safety net providers, which are specifically charged with serving low-income patients. In particular, the problem that we were looking at was trying to make changes to the CTA bus network, minor changes, just moving buses around to different lines to adjust their frequencies in order to try to improve the equity of access to the primary healthcare facilities, while making sure that we remain within a reasonable margin of current service levels. So I don't have very much time to actually talk about the overall model structure. So I will just say that the decisions we're thinking about making are just reallocating buses, moving them from one line to another to adjust their frequencies. The way that we set up the objective of our function is that we are trying to explicitly maximize some measurement of social access, which I'll explain a bit in a moment. And then we take the things that would normally be the primary concern of a transit design model, and we're treating those as constraints. So rather than trying to optimize operator costs, so the monetary costs of running your network, and user costs, which would be the travel times of users, we're going to instead explicitly bound them so that they don't increase by more than an acceptable margin above their current levels. And that allows you as the planner to choose exactly how much service you're willing to sacrifice in exchange for improving equity of access to healthcare. Let's take a look at what the results of our model was. So we set up this model to attempt to improve the equity of access across the city. And here's the result that we got after 500 search iterations. And you can read in our paper more about what exactly the model is doing. On the left side, this is what the accessibility metrics look like on the original Chicago Transit Authority network. And on the right is what it looks like after we've made our changes to the network. Generally speaking, in the original network, there were very high levels of access near downtown, which is also where most of the facilities are located. And then the periphery of the city has comparatively low access, and things have generally evened out after 500 search iterations, after moving some of the resources around. Here are the relative changes. Generally speaking, some parts of the city improved and some of them worsened, but the parts that improved are the ones that started off the lowest, and they underwent a comparatively large relative increase compared to the relative decrease of the rest of the city. Here are the actual numbers. And what I'd like to point out here is, if you look at all of the different areas in the city, the mean and the median access levels did not change very much. But the standard deviation decreased by quite a lot, which means that after we've reallocated our resources, all of the metrics are generally much closer to each other. The maximum decreased by a little bit, but the minimum increased by quite a lot. Here's the objective value of our overall objective function, which in this case was essentially to focus on 8 of the 77 Chicago community areas, the ones that have the lowest level of access. And that's dynamically adjusted as we run our search. So as we make changes to the network, we're constantly trying to take whatever are the current 8 lowest metrics and optimize those, which leads the model to try to focus resources on the areas that currently have the lowest level of access. The overall objective increased by about 44%. That tick in the middle, where we suddenly experienced a really rapid increase, is where the model first started to switch buses onto express runs of existing lines instead of just moving them around between existing lines. I think I don't have that long. Let me just get to the conclusions. So the model that we presented in our paper is meant to be very general. I was just talking about primary healthcare metrics, but you can use a similar sort of metric to measure access levels to any kind of service that you think is important. And the way that we set up our constraints is also meant to be general. So the exact way that you measure things like user costs and operator costs can also be adjusted depending on your needs and depending on what exactly it is that you're studying. We ran some sensitivity analysis by repeating this study many times over on a very small test network. And the modeling parameters are fairly robust to changes. You can change them by a little bit and it doesn't significantly affect the outcome of the model. The results of the Chicago case study are interesting, to say the least. It does suggest that it is possible to implement some minor immediate changes that could improve equity of access throughout the city, although it is based on quite a lot of simplifying assumptions. So any plans that we come up with out of this model should be regarded as preliminary suggestions and things that need to be considered more carefully as part of a more intricate model that has more intricate assumptions. And I think that's all the time that I have. The source code for our model is up on my GitHub. You can also find the raw data. And all of this is linked to in our report. But I'll end for now, and thank you all for your time.
Thanks so much. Really interesting stuff. And I grew up in Evanston, just north of Chicago. So as someone who has rode public transit from the University of Chicago area to the north suburbs of Chicago, I just had that, wow, that makes sense when you said that you shifted some of the transit onto the highways and that made that big difference. So cool. One question that this has raised for me is about the kind of balance between reallocating versus expanding funding. And do you have an idea of if there are sort of additions that might be just for a small expansion of funding quite superior to what you can get from all the most complex reallocations you can come up with, or any way to kind of balance those two different strategic approaches?
I think probably the biggest thing that might help that we didn't really consider in our study would be making alterations to the train network. We were only considering reallocating buses, but the train network moves much further and much faster and tends to be a much more significant part of people's travel times, especially over large distances. We didn't consider changing the train network because it didn't really seem as reasonable that you could just move a train to a different line. But I think that would make a much bigger difference.